I'm the founder of an organization, breast cancer organization called BreastSens, based in Johannesburg. And I do advocacy, patients' rights advocacy and education, particularly amongst poor, rural, urban, peri-urban black women in South Africa. A lot of women, particularly African women, are not accustomed to standing up for themselves and asking questions. Africa is, for the most part, a very patriarchal society. So women face the double whammy of being female within a sociocultural context, and then having to go into the doctor's rooms as healthcare consumers. And, I've just found from my work that women are very placid. They listen, they don't ask questions. And the mission for BreastSens, and particularly myself, is to empower women and make them realize that they're not getting medical treatment for free, that they are healthcare consumers who are paying for a service. I started as part of the recent Lance Armstrong Global Cancer Summit in Dublin, a campaign that's called Vikela Amabele Am, which is isiZulu, South African language, which means protect my breasts, mostly to help empower women, as I said, in terms of body autonomy. I have a legal background, so body autonomy and issues of rights over your medical decision-making and access are very important to me. So we're calling it Vikela Amabele Am, or I am calling it that, to help women stand up for against social-cultural issues that mitigate against them getting access to timely breast health care. For instance, we have an institution in South Africa that we call Lobola, which is bride price. The husband's family traditionally pays to the woman's family for her hand in marriage. And we've heard absurd situations where some men say, because I've had to pay that, your body now belongs to me. And that is very frightening when we come within the context of breast cancer, where women have to have mastectomies, as suggested by medical practitioners. We have had women, about 5 to date, who've come back and said, I cannot have my mastectomy because my husband says that will be defiling his property. So that whole notion of a woman's body as property flies, in my mind, totally against the issue of international human rights, the South African Constitution, which is very pro-equality, issues of access to medical care, and just fundamentally the issue of being able to make an informed decision about your access to medical care. I'm very excited. I'm relatively new in the advocacy landscape, breast cancer advocacy landscape in Africa. And, I must mention that I am a survivor. And there's a lot of stigma associated with cancer, especially the issue around breasts. So coming to IOTIC for me is a launch pad to be able to understand what the cancer dialogue within an African context is, because I think African people need to start setting their own path, because we have problems, cancer, social, cultural issues that are unique to us. Partnerships with the rest of the world, especially the West, are absolutely critical, but African voices, especially the professional advocacy voices, have to start emerging within a global cancer framework.